Acute myeloid leukemia, referred to as AML, is a bone marrow cancer caused by incomplete maturation of blood cells and reduced production of normal hematopoietic stem cells. Normal blood cells move freely in our bodies. Red blood cells carry oxygen, white blood cells fighting infection, and the platelets keep the blood flowing freely to prevent any clotting. Hematopoietic and stem cells are an adult type of a stem cell that is formed in the bone marrow, which is the long, spongy material found in the center of long bones. These cells then develop into red blood cells, white blood cells, and platelets. AML is a change in our genetic material, otherwise known as our DNA, which causes alteration in the cells, leading to damage and scarring in the marrow. The altered cells continuously then reproduce themselves, and then they travel throughout our body into the organs, interfering with the normal function. Without treatment, AML will progress rapidly. When the altered cells build up in the bone marrow, they crowd out the healthy cells and interfere with normal reproduction of the blood cells, which leads to a deficiency of the normal red blood cells, white blood cells, and the platelets. When the cells become unhealthy, we start to feel symptoms of weakness, shortness of breath, fatigue, recurrent infections, body aches, and night sweats, which gives us our bodies a sign and symptom that we need to seek medical attention. Once we go to a provider, they will do a complete physical exam, which includes lab tests, normally a complete blood count to tell the provider whether the levels of the red blood cells, our white blood cells, and our platelets are normal, or if they're low. A peripheral blood smear is used to study a sample of the circulating blood in the body and abnormality of the blood cell shape. Any suspected AML is confirmed with a bone marrow biopsy, which is looked at underneath a microscope. Once AML has been confirmed, the treatment includes an induction therapy to rapidly restore bone marrow function, which is chemotherapy, and it helps to reduce the number of cancer cells in the body and prevent more from forming. The type of chemo and the dosage depends on the age of the patient. Post-remission therapy is a therapy that begins after AML is in remission. The purpose is to kill any remaining leukemia cells that may not be active but could begin to grow and cause relapse. For further information on acute myeloid leukemia, I've attached a couple of references.